Hello, my name is Tiffany Shavar, and this is Biology 225 with Professor Stansel. I'm going to be going ahead and presenting my clinical case study in this fashion with the identification of a gram-positive urinary pathogen in a case of a toddler. I will be describing a pediatric case that involved a toddler, as previously stated, with a prolonged fever of an unknown origin. This fever, again, was the only symptom that arose within the toddler, and it concluded to the identification of the pathogen and proper diagnosis. The organism that was found on the microbiology testing was Enterococcus faecalis, which is a gram-positive bacterium that is normally found in the GI tract and is not harmful. It can cause urinary tract infections in pediatric patients, which in this case it did. As again previously said, there was no clear source of infection. The toddler only presented with a prolonged fever, and because the patient is pediatric, a urinary test is always warranted and indicated for proper treatment. We went ahead and obtained a urine sample through a clean catch process, meaning that the urine would not be contaminated, alongside obtaining the sample from the patient. Differential testing was used to narrow the organisms and to be able to identify them as well. As stated again previously, the bacteria found was gram-positive. There was growth on the agar plate, and there was a negative catalase test as well. We went ahead and confirmed again the gram-positive cocci, leading to the gram-positive organism. I apologize, and which then led to the diagnosis of a urinary tract infection in this pediatric patient. Proper treatment went ahead and warranted through antibiotic therapy. Commonly used in pediatrics is going to be amoxicillin. You want to go ahead and instruct your patient to increase the fluid intake throughout this period, and also